they said in the beginning they were separating the babies from the moms when they were born if they did contract the virus. And to me, that was so scary.
So horrible. Like I was in labor for 18 hours. It just seemed like everything went wrong.
Basically, panic and fear was the first thing that set in.
Have been a slight fear early on of just what that would look like if I was to get COVID.
So delivering during this time was pretty terrifying. It's like out of a sci-fi movie.
Hey there, I'm Troy Michelle. I'm 34 years old from Richmond, Virginia, and I gave birth to baby number 6 on April 14th during the COVID-19 pandemic.
I'm Liz Teich, and I'm a fashion stylist and lifestyle blogger for thenewyorkstylist.com. And I gave birth through a global pandemic in the peak, in an epicenter, and I did it. And we're all healthy, and I'm here to tell you all about it.
Hi, my name is LaQuanza Jackson. I am 37 years old. I live in Charleston, West Virginia with my family, my husband, Chris, my 7-year-old son, Kenyon, and I recently gave birth to a healthy, handsome baby boy named Christian.
Hey everyone, my name is Ariel Tyson and I am a pastor's wife in Montana. I'm a mama to 6 boys. This is my tiniest one who was just born almost 2 weeks ago, and my oldest just turned 9 right after he was born. When I first heard about COVID-19, I don't think I had quite as many fears as several of my friends did, and then several of my followers who are pregnant mamas, just simply because I was already planning a home birth and I had already had 3 other ones before, and this was my 4th, and it was already planned.
So when I first heard about COVID-19 was from watching the news, basically. We were watching the news and we just saw everything that was going on in China, and how so many people were becoming infected with this virus and dying, and we were just in shock.
When we first heard about COVID-19 and that the whole coronavirus pandemic was coming this way, I mean, it was scary enough that like we could get it and, you know, my toddler could get it, but the fact that we didn't know if it could come through to me and I could pass it on to my baby, that was really a terrifying thought.
So when I heard about COVID-19, the first thing that came to my mind was the health and safety of myself and the baby. Of course, I didn't want it to spread to my other children, but particularly with this pregnancy, I wanted to make sure I was safe and give this newborn a fighting chance.
And then as far as the implications go for pregnant women and for babies, I do think there might have been a slight fear early on of just what that would look like if I was to get COVID, spread it to the baby, just because we knew so little about how it impacted pregnant women and about how it impacted babies.
There were a couple babies that were born in China that they said, oh, they were fine, but like nobody really knew. We didn't know what the repercussions long-term could be. And that was really terrifying to think about. And I had asked my OB in the beginning, what can I do to prevent it and, you know, protect myself and my baby? And they just said, wash your hands. And to me, that wasn't enough. And it was really a scary thing to think about.
Frankly, I wondered, would it even be safe to give birth in the hospital at all? Like so many other mamas, I looked into giving birth at home, and I think I was about 38 weeks or so I wasn't sure if I even wanted to make that switch and get to know a new provider so quickly and invite them into my home. Would that be safe? Because they could expose the rest of my children once they got in the home. So basically, panic and fear was the first thing that set in when I heard about this pandemic.
I remember one of my appointments, my doctor was telling me, yes, that I would be able to have a support person in the room with me. I was fine. But then later on, I started hearing that no one will be allowed in the hospital room, just the mother giving birth. So then that's when I guess my anxiety started.
So delivering during this time was pretty terrifying, I have to say, in the beginning. You know, I gave birth not during a global pandemic, and it was already like kind of nerve-wracking being a first-time mom, but to add the added anxiety of you walk in and all your medical staff is in full-on PPE with the face shield and like extra layers and totally armored up, ready to go into battle just so you can give birth. Like that was really scary, and it was hard to relax. All my hypnobirthing techniques kind of went out the window because I'm like, this is something I just never would have thought I experienced. It was like out of a sci-fi movie. So it was definitely different than my first birth. I was really lucky that as soon as my husband and I were able to get tested and the test results came back within an hour, they all found out that I was negative and immediately ripped off all the PPE that they didn't need, and we all wore surgical masks. And that was definitely comforting to everybody. I think the mood in the room just shifted and everybody kind of calmed down and kind of joked around finally, and I was able to relax a little bit more. But I mean, breathing through a surgical mask is hard enough, but try breathing through the strongest contractions that are like 30 seconds to a minute apart. That was definitely a lot more challenging than my first birth, I have to say.
So ultimately, I decided to give birth in the hospital. Looking back on it now, I feel as though it was one of the best birthing experiences I've ever had, given the circumstances. Aside from the medical staff having to wear masks the entire time that we interacted, it was a very pleasant experience. I believe that the hospital knew a lot of families would be overly anxious to give birth in their facilities, and so they went above and beyond to make sure all the families were very well taken care of and felt comfortable and welcomed. And I feel like they knocked it out of the park. I will say that the experience was a little bit cold because interacting with the medical staff, like I said, they had to have a mask on, so I couldn't pick out my nurses in a lineup if I wanted to save my life.
As far as the delivery experience went for me, it was pretty much very similar and standard to all of my previous home births. My water broke, contractions started a little while later. It was about a 3-hour and 15-minute labor, and then baby was here, and it was all in my home, and it was safe, and I didn't have extra germs. So for me and my experience with a home birth, not much changed.
And so my delivery experience was different. Like I said, this is my second child. And this time around, it's different because I didn't have as much support in there as I did the first time around, which was definitely needed. I was scheduled to be induced on the second, and my baby was like, I'm coming anyway on the second. So I woke up in full-blown labor. Contractions was 2 to 3 minutes apart. So I got there nervous because they was like, they called me at 4 in the morning and said, you can come in at 6. I went and they said you have to go through the COVID pre-screening through a tent before you can come in the building. So we went through this tent. They took our temperature, asked questions, whatever, which was fine. And then we went inside to another station and answered some more questions, and they gave us a mask to put on that we had to have on the whole time while we were in there in the building. And as everyone should know, it's kind of hard breathing through those masks. And then, you know, in labor and sweat and trying to breathe, it was not easy. It was not easy, and it wasn't fun because I was hot, tired, and just it was hard to breathe.
But I will say the biggest part about this birth that was most challenging was that I had to advocate for myself more than ever. And the first time around when I gave birth in Brooklyn and not in a pandemic, I didn't know what to expect, and I was really lucky that I had my doula by my side and she was able to advocate for me. But this time I had my doula on FaceTime next to me, and it was hard for her to interact with the nurses directly. So it was really on me to, you know, voice my opinion and to say what I needed, because the medical staff at this time was so understaffed and so overworked. There was a time in the beginning when I said, I need this, I need that, where they were like, okay, you know, we'll get there. But then finally when the baby was crowning, like I was like, okay, the baby's coming. I need the OB to come in and check me. And they were like, oh, you're fine, you have some time. And I said, no, like this is happening. And being a second time mom, I kind of knew what to expect when it came to that part. And OB came in like almost instantly when I said that. And I gave birth to my daughter 8 minutes later. Like I pushed out in 8 minutes.
I never got to see their faces, so it kind of felt impersonal. And also, you know, being transitioned from the delivery room to the recovery room, I didn't see another patient. I didn't hear another baby. It was like a ghost town. It just felt very isolated. But once I got in that room with my baby and my partner, it was amazing.
It was just different, you know, having all these people come in a room and they having masks, and you could just tell it was the aura in the room. It was just weird. It was weird. So that experience is definitely one to remember.
For me, it was pretty standard to what I've experienced before. For me, because I did have a home birth, yes, my partner could be with me. My husband is my birthing partner, but I also had a midwife and 2 apprentices of hers there as well, just to help with the flow of everything. So for me, I was very comfortable in this.
Yes, so fortunately, my partner was afforded the opportunity to attend the birth of our baby. He also got to stay with me during my recovery. Now, he wasn't allowed to come and go, to leave and get clothing or food or anything like that. So to make up for it, the hospital did provide all of his meals during the entire stay. And I'm very grateful for that.
So I was really fortunate that I gave birth during a time where they had just announced the executive order where partners were mandated by the state of New York to be at the birth. It was a mandate that, like, it was so important that birth, you need your partner. You need somebody there to support you. And I was so grateful to have my husband by my side. There were a lot of people that weren't as fortunate, and I feel really lucky that I had my husband, because I needed him while I breathed through my face mask during contractions. He held me close and he let me pull down my mask so I could get a big gasp of air, and he reminded me to breathe. And he, you know, just having that reminder and by your side, it's not, you know, having somebody on FaceTime, it's just not the same.
Like I said, this is my second child, first time around, same hospital, same doctor. I was able to have my husband in there, my mother-in-law, my sister-in-law, and my best friend. And this time around, it was just my husband. I know that some hospitals aren't allowing the mothers to have a support person in the room with them. And I don't see why or how. I mean, I understand why, you know, to prevent the spread of the virus. But if anything, make everyone take a test before coming in, at least, you know, a day or 2 before coming in. Enough time for them to get the results back before delivery or close to due dates. Because I feel like every woman needs to have at least somebody in there with them. The notable difference from giving birth during this pandemic in 2012 when I had my first son, I would just think the fear of being sick and giving birth to a child and passing it on to your child, or just your child catching it from just someone in the hospital.
So I will say the biggest part of giving birth in a global pandemic versus giving birth not in a global pandemic was that I really had to advocate for myself. I felt like the hospitals were so overworked and understaffed, and there was just so much that I needed to put my foot down and say, this is what I need.
So the most notable difference that I noticed while giving birth during the pandemic was just how impersonal it felt. The interactions with the nurses that I already didn't know just felt a little bit disconnected because they had their masks on and all their gear. And so I never saw their faces, and I couldn't tell whether they were smiling or, you know, trying to be friendly with me. It was just very hard to make that relationship with someone you're just meeting and about to go through this life-changing event with.
I think the most notable difference to birthing during the pandemic is the precautions that we had to take, extra precautions, extra gloves needed at other times that we wouldn't have used gloves, or masks used, and those kind of precautions that do make you think about it, like I'm bringing a baby into this world with everything that's going on.
It's just that fear, you're already in fear giving birth and thinking something might go wrong. But to have that elevated fear of something might go wrong, and you may pass on the virus to your child, or you may become ill and then you may not be able to breastfeed. There's just so many things, underlying issues that just begin to build up in your mind.
And I think it's an important message for all moms, even if you're not going through this during a global pandemic, but anybody that is giving birth, you really should advocate for yourself.
So I would say the extra precautions is the biggest thing, and because of that, it can change your mindset and your emotions because you think more about it.
Also, the hallways to the hospital were very empty. Felt like a ghost town. Because I guess a lot of the other patients were just afraid to walk through the halls for fear of, in fear of getting exposed to something. So everyone kind of stayed in their rooms, and it just felt very cold and isolated. So there was never a point in time when I felt at risk or in danger. I never felt that the health and safety of my baby was in jeopardy. The medical staff always wore their masks and gloves anytime they came in my room, as well as the meal service. When they delivered our meals, they were covered. And whenever we walked in the hallway, which was never, but it was a requirement by the hospital, we had to wear a mask as well. And for the most part, we just stayed in the room. I kept the baby in the room as well. He was never sent to the nursery. They even gave him his first bath in the room. They did his hearing screening. Most of his exams were done within our room.
I personally never felt threatened during my birthing experience, and didn't feel threatened for my baby as well. And I think in large part is because I was doing the exact same thing I'd always done. Some of my appointments were different, of course, and then some of my appointments since baby have been different, where I need to have my temperature checked and wear the mask and everything. But overall, I have not felt threatened myself personally or my baby.
We stayed 2 nights in the hospital. At no time while I was in my hospital did I feel threatened about my safety or my baby. Like I said, everyone who entered my room for labor, delivery, and after had a mask on. They all cleansed their hands, and we did the same. So I did not feel threatened at all. My hospital took very good care of us.
So for my delivery, I didn't feel like my safety was threatened whatsoever. I was so grateful that the hospital took so many precautions. They screened everybody upon entering. They triaged us right to the delivery room. No questions asked. They saw me doubled over having a contraction in the parking lot, and they came over with a wheelchair and no words. They just wheeled me right in, right up. And I just felt like it was so safe, and really like they had all these protocols in order that made it a little bit easier. Didn't love that I had nurses and people I didn't even know coming in and out of my room what felt like every half hour. I had housekeeping come and clean my room 4 times in a 24-hour period, and I was too tired to argue with it, and it was her job that I didn't want to say anything. But to me, it was like unnecessary how many people I interacted with. And during this time, you're told to not interact with people and not get that close to people. And here I am having people come in and out of my room that I don't know if they're, if they have the virus, or if they're around people, being in a hospital and can contract the virus and pass it to me. And more importantly, my newborn. And so that was probably the scariest part, and the part where I felt the most like my safety was at risk. So looking back at my birth experience, I don't know if I would do anything differently.
As far as what I would have done differently, regarding the delivery of my baby, there is not much I would have done differently. I decided early on to have the birth experience that I wanted. And for me, that was in home. I have hospital anxiety.
Looking back on at my delivery experience, I don't really think we would have done anything differently.
So now that we're safe and home and healthy, looking back now, I wish I would have known that everything was gonna turn out fine. You know, I wish I would have relaxed a little and enjoyed the last few days of my pregnancy and not panicked so much and lived in a state of anxiety leading up to the delivery. Just knowing that, you know, delivering in a hospital wasn't going to be as bad as I presumed it to be or made up to be in my head, because everything turned out fine, all things considered.
To all the expectant moms out there who are uncertain of your delivery experience, I want to provide you with encouragement and advice. First of all, research your options. If your hospital is not doing the things that will make you feel comfortable in your birthing experience, what other options are there for you? So look at the different options that are out there for you and research. Be your own advocate. Figure out what can be done and what can't be done legally. And so when you are going into this situation, find out everything you need to know about the hospital, about what they're going to have you do and what they're going to do with your baby, and decide what is best for you.
All the expectant mothers out there who are scared, nervous, unsure about how the delivery process is going to go, I say talk to your doctors. Start there. See what he says, what the policy is for the hospital you plan on delivering at. If it's a policy, no support person policy, check to see if there's another hospital that you may be able to give birth at, that your support person may be able to attend with you. For mommies, when it comes to you and your bodies, please try not to stress, because when you're stressing, you're putting stress on the baby, and that's not good. So we want you to have a healthy delivery of a healthy baby, boy or girl. So try your best not to stress.
But I will say, I wish I had known that it was okay, and it was okay to be scared, and it was also all going to be okay. Like the fact that I got through it during a global pandemic in the peak, in like the epicenter. I was living in a containment zone originally, and I was terrified leading up to the birth. And I think my whole pregnancy, I mean, at least during this whole time, my pregnancy was very anxious, and I wish I had just realized that it was going to be okay. And I mean, there was no way at that time to know because it was very unprecedented, but the fact that people are getting through it and having healthy babies, and there really haven't been any instances of people contracting the virus during birth, I think that is just such a comforting idea, and I hope that helps other people, because that's something I wish I had known.
So nobody said this to me when I was pregnant, so I'm gonna say it to you. And to all the expectant mamas out there, you are stronger and more capable than you give yourself credit for. Whether you're planning on having a vaginal delivery or a C-section, whether your partner is in that room or not. So give yourself permission to enjoy these last few moments of pregnancy, because you're not gonna get them back. Plus, at the end of the day, when all is said and done, you're gonna walk away with the greatest gift you could ever give yourself. So take a deep breath, mama. You got this.